Please stand and join me in welcoming the 57th Governor of the great state of New York, Governor Kathy Hochul.
Okay, good morning, everyone, and welcome to Lincoln Hospital.
Good morning.
Hey. I want to begin by thanking our Congressman Ritchie Torres for his continued advocacy and support for Lincoln Hospital and the South Bronx. Thank you for always making sure our community is seen and heard. I also want to thank our Governor, Kathy Hochul, for being with us today. Governor, you are always visible and accessible. Thank you for choosing Lincoln to stand with New Yorkers during this fight to protect health care. For our patients, our staff, and the South Bronx community, your presence here today tells them that they matter, that their families matter, that their future, their outcomes matter. At a time when so many are worried about what these cuts to health care could mean, you bring hope and strength. Finally, I want to thank our President and CEO, Dr. Mitch Katz, for always standing with all of us in health and hospital system and our communities. Yes. I'm so proud to stand here today representing this hospital because Lincoln is more than just a hospital. It is the heart of the South Bronx. We have the busiest emergency room in New York City and one of the top trauma centers in the country. Every day, families come to us, families who are scared, families who are struggling, and they place their trust in us. These cuts are not just numbers on a page. They are people's lives. That's why today matters. By standing together, we are sending a message. Lincoln is not alone, and neither are the people we served. With Governor Hochul, Dr. Katz, and Congressman Torres by our side, we are stronger. We will keep fighting for affordable quality health care so that every family in the South Bronx has a place to turn when they need care. And now it's my great honor to introduce the 57th Governor of the great state of New York, the Honorable Governor Kathy Hochul.
Thank you, Christina. Christina Contreras, thank you for hosting us, number one. But to all the members of the medical facility, the staff, the doctors, the nurses, support staff, administration, I just want to tell you how grateful we are that all of you have dedicated your lives to bettering the health and outcomes for people in the South Bronx and all over. And to be the busiest ER in New York City, but the third busiest in the United States of America, is something that we should salute. Let's give them all a round of applause. Cassandra Howell, our Chief Operating Officer, I want to thank her. You'll also be hearing from one of our constituents here, a Medicaid recipient, Ms. Martinez, who will be joining us in a few moments. All my partners in government, state officials have been recognized. I see you so often. City Council member, we have Gail Brewer here, I noticed, probably some others, our city council members, my administration, many people from my administration are here, and all my partners. Also an individual who's a tireless fighter for the South Bronx and beyond. You are so blessed to have represent you in the powerful halls of Washington in Congress. Your Congressman Ritchie Torres. Let's give him another round of applause. Now, I just have a few observations. And I'm from Buffalo, You're from the Bronx. Let's just talk straight. What Republicans in Washington have done through the big, ugliest bill I've ever seen is literally screwing New Yorkers. I'm just telling you straight. There's no way to sugarcoat it. It's all bad. It's all bad. Now let's count the number of people. 1.5 million New York residents will lose their health coverage through Medicaid. Those are our friends, our family, our neighbors. But let me just tell you the statistics here in the Bronx. Right here in the Bronx, 107,000 people will lose their coverage. You're all going to know somebody. Now, where are they going to go for health care without this insurance? Oh, they're still coming here, but there won't be any way to pay for that. Christina, what does that do to the health of a hospital like this? That's unsustainable. And we'll keep you strong. But sure as I'm standing here, there's going to be hospitals all over the state of New York that are going to close, especially in our rural areas, up in the North Country. Those hospitals are already far apart. Imagine expecting a baby. Your child's in a car accident. You need to get to a hospital. And it's hours away because they had to close because of what Republicans who even represent that district have done. That's what we have to contemplate. And let's talk about another issue that's so important. Feeding children. And this is America. We're a very rich country, right? We should at least be able to feed our babies. And I've take this so personally. My daughter has a new baby, 5 weeks old yesterday. She sent me another picture today of her feeding the baby a little bottle. She doesn't have to worry about whether she can afford that formula because we can take care of it. But there's so many families across this great country who want to feed their children, but they're struggling. They didn't ask for a pandemic. They didn't ask for inflation. They didn't ask for tariffs to drive up the cost of everything. And by the way, what we promised, lower prices day one of the Trump administration? No. They're going way up. So my daughter can take care of her baby, but families here in the Bronx are going to be struggling because they count on the SNAP programs that feed our children and our families. So how cruel and depraved is it to not just take away a basic human right to have health care when you're sick and you need it, but also say, we don't give a damn if you go hungry either. Republicans in Washington have lost their soul. But here in New York, we have not lost our heart. We'll always care about people. We'll never give up on them. We'll fight back. We'll fight back hard. But it is also disgraceful. It is disgraceful that New York State has 7 Republican members of Congress whose job it is to go out there and fight for their constituents. Some in suburban areas, some in very rural areas. Your job is to represent those people and not do the bidding of a dictator like Donald Trump. But what do? Oh, they rolled, they caved, they didn't even put up a fight. And now one of them is actually running ads trying to persuade you how great this is. We're not stupid. We know the effects. There's no way you can say this is a good bill. It hurts people. And they missed their opportunity to show some profiles and courage. Any one of them could have stopped this from happening. Any one. All it took was one person to change their vote. They turned their backs on all of us. So now what do we have to deal with? Massive cuts, $13.5 billion cuts to health care in the great state of New York. Millions will lose insurance, will lose nutrition programs, or even hurt Planned Parenthood programs, which in some parts of our state, that's the primary health care provider for women. They don't care. And I'm just ticking off a few of them here today because we're at a hospital. But the effects of everything else is absolutely devastating. Now, I'm fighting hard. I've got my legislators. They know what we did. They helped me put money back in your pockets. We had a whole strategy last January, making New York more affordable because we know what's going on out there. People are working harder than ever before, and they're falling further and further behind. It's just not American. It's not what people came here for this country for, lived here, spent their lives here, making it a great place. They always think the next generation is going to do a little better than the one before. But the generation today is stuck. The chance of home ownership is impossible. Trying to get their own apartment seems impossible. And this is not their fault. What we did was he said, let's figure out a path. So for families with children under the age of 4, $1,000 tax credit for them starting in the next year. $1,000. Older kids, age 4 to 16, $500 in your pockets. It starts adding up for families. Let's put some money back in their pockets. Also, because there's so many children that need assistance paying for school lunches, those kids are stigmatized. They stand out. Everybody knows that they're the ones, the parents who can't afford to feed them, and so we have to. That creates a stigma for those children that lasts with them a lifetime. And why do I know that? I was on a Long Island talking about this. A Republican state senator came up to me, and he says, what you're doing by giving free lunches and breakfast to every child in the state of New York is transformational. And I was surprised to hear that. I said, why? He says, I was that kid. I skipped lunch every day because I was too embarrassed to get in the line for the kids with subsidized meals. And you're changing people's lives, giving them dignity back. So free lunches starting this fall, free breakfast, so no child will go hungry in our school system. So you can do what you want in Washington, but I'm feeding our kids. I fed kids my entire life. I'm a mom. I know how to feed kids. But also, how we open up doors of opportunity for people. One of them is a college education. Why do I know this? My parents used to live in a trailer park in the shadow of the Bethlehem steel plant where my grandpa worked, my brothers worked, my dad worked, his brothers worked. Everybody worked at the steel plant. A little tiny trailer. My dad, while he was working at the steel plant, was able to get a college degree at night. When he got that degree, he was able to start the path of getting his family, that little tiny apartment where I came along, and little houses, success. And I want that opportunity available to everybody. But cost of tuition is too high, right? You try to just pay your utility bills, pay the rent. Think about possibly money for education for your own kids. I want adults who really want to do something different in their lives, to better themselves, to have more income earning power, to have that shot without being strapped with the high cost of tuition. So that's why starting this fall, we worked together at the legislature. We got this done. Free community college tuition picked up by the state of New York and all the other expenses that go along with it for adults 25 to 55 going into key professions where we have shortages of workers. This also helps our employers. Healthcare. Christina, you have shortage of healthcare workers here? You're going to see a lot more people coming in your door when this happens. We already have actually now the number is 16,000 people have signed up this fall already. And we're picking up that cost of tuition. I am so proud of that program. So here's what we're doing. We also have the inflation rebate. So people say, no, don't give that money back to the people of New York. Do something else with it. Really? You gone shopping at a bodega lately? Gone to a store? Trying to see a mom trying to be back to school shoes for the kids, little backpacks? You don't think they can use a few $100 this fall? $400 for most families? I think they do. You think they need that? Well, then tell everybody else, all those naysayers. Clearly, I don't listen to them. So, and then how about the largest middle-class tax rate cut in 70 years? So this is how we've figured out a path to put upwards of $5,000 back in the pockets of our hard-working New Yorkers. Now, I'm proud we got this done. This is great. But on the other hand, put money back in this pocket, the Trump tariffs and the cost of everything are driving everything up. People just aren't going to get ahead. So what do? We support our hospitals, our healthcare workers, our institutions. We'll do what we can. I'm working with our leaders in the legislature. We're making up $750 million in cuts this year alone. We weren't expecting that. I'd rather be able to give that money to Christina. I know exactly how she wants to spend it. She told me. She told me how she wants to spend this. We'll get you there. Not the $750 million, just part of it. She wants $14 million. Sure, let me check. Let me see how much I've got. Every time I come to the Bronx, I leave with my pockets lighter. I'm just telling you right now. You guys are so good. Listen, you had me at hello. I love you. So we're going to continue the fight. And for those who are giving up, saying, you know what, I just can't fight anymore. It's too much. History will judge us by how we stand up in this moment. And I want it to be said that New Yorkers stood up and fought back. We've been fighting our entire history, and we're not about to stop now. So let me bring up to you, my friends, another great fighter, a fighter for the Bronx, a fighter for our country. Let's hear from our Congressman Ritchie Torres.
Governor, it's an honor to have you in the Bronx. I know Buffalo's your first home, but please consider the Bronx your second home. First, it's an honor to be here with Cristina Contreras here at Lincoln. You know, Lincoln is the safety net of the Bronx. As Lincoln goes, so goes the Bronx. And I know every elected official is committed to the success of Lincoln. So, Cristina, thank you for everything you do. Look, the presidency of Donald Trump represents the gravest threat to our democracy, our economy, and our social safety net. And now more than ever, every single one of us should stand with our governor in the fight against Donald Trump. Now is not the time for infighting. Now is the time for unity under the leadership of our governor, Kathy Hochul. And I'm here to repeat what the governor said. There is nothing beautiful about the so-called big, beautiful bill. In fact, the beauty of the big, beautiful bill is as fraudulent as Donald Trump himself. It is an assault on working people. It's going to cause 17 million Americans to lose health coverage, including more than 1 million here in New York. It will slash Medicaid by $1 billion, the largest health care cut in history. It will slash SNAP by $300 billion, the largest food assistance cut in history. It will raise the cost of electricity for American families and businesses, and it will add $4 trillion to our nation's debt. You know, here in the Bronx, we have people who live on $20 a day. And so Donald Trump and congressional Republicans are going to cut food, health care, and energy for those living on $20 a day in order to hand tax breaks to billionaires like Elon Musk, who has a net worth of $400 billion. And under Trump's legislation, and I'm not kidding, it is actually possible for a company like the Trump Corporation to buy a $400 million Qatari airplane, claim it as a business expense, and then completely write off the cost. So he's cutting health care and food, the essentials for working families, in order to subsidize luxury air travel for billionaires, for the top 1%. And it's often said that when America sneezes, the Bronx gets the flu. We are going to be hit the hardest by Donald Trump's savage cuts to food and health care. Right, 1/3 of the Bronx is enrolled in SNAP. And my congressional district, which is exclusively in the Bronx, has the highest rate of Medicaid enrollment in the country, 70%. In my district, more than 70% of children, more than 80% of nursing home residents, More than 90% of baby deliveries are covered by Medicaid. Medicaid is the air we breathe in the Bronx, and we will do everything we can to stand with Governor Hochul to defend it against Donald Trump. Now, Donald Trump and his Republican co-conspirators here in New York and elsewhere would have you believe that a $1 trillion cut is all about removing fraud, waste, and abuse. Well, if that were remotely true, I have one question. Why would it be necessary for the Congressional Republicans to set up a $50 billion stabilization fund for rural hospitals if it were all about fraud, waste, and abuse? The very existence of a stabilization fund is an admission that Congressional Republicans are destabilizing our healthcare system. It's an admission that Congressional Republicans are lying to the American people. And why is there only a $50 billion fund for rural hospitals? Why not for the hospitals here in the Bronx? Why not for Lincoln Hospital, which has the busiest single-site ER in New York City and the third busiest in the United States? Why is the Bronx being left behind? You know, Donald Trump came here to the Bronx to campaign. He stood in Crotona Park, which is about 1.5 miles away, and he promised to champion working families. And instead, he has betrayed them. But thankfully, we have a governor who is willing and able and has the courage to hold Donald Trump accountable for his betrayal of working families. And so, Governor, I want you to know we stand with you. The Bronx stands with Governor Hochul. Governor Hochul stands with the Bronx. Now more than ever, we have to defend our democracy because everything is on the line. And if we do not fight for the health care needs of the Bronx, then no one else will. The burden is on our shoulders. God bless you. Thank you.
Please welcome to the podium, Cassandra Hochul.
Good morning, everyone. I'm Cassandra Hochul, the Chief Operating Officer at Public Health Solutions, the largest public health nonprofit serving New York City. First, I want to thank Governor Hochul and Representative Torres for bringing us all together here today. Let's be clear. The passage of H.R. 1 is a direct attack on underserved families. Gutting essential programs to fund tax cuts for the wealthy. The first casualty is New York's Essential Plan. Our state stands to lose $7.5 billion in revenue, and then spend $2.7 billion more to push people onto Medicaid. Public Health Solutions has been connecting New Yorkers to critical services for over 65 years. WIC, SNAP, maternal health, sexual reproductive care, and health insurance. I grew up in a single-parent household in the South Bronx. I know personally how much these services matter. Through our health insurance enrollment programs, we help over 17,000 New Yorkers apply for coverage each year, helping to drive down the uninsured rates in the state. Because of these federal cuts, 224,000 people are set to lose essential plan coverage, most of them right here in New York City. 7 out of 10 New Yorkers can't get care without insurance. That's not wrong. It's a crisis. The harm doesn't stop there. Nearly 300,000 households across New York are projected to lose some or all of their SNAP benefits. That's $220 less per month for groceries. Take Miss A, a mother of 4 children, ages 5 to 16, and one of our program enrollees in Staten Island. She recently told one of our healthcare navigators that she worried that the new work requirements, combined with her ongoing immigration process, will likely hurt her family. Without SNAP, she feels that she won't be able to put food on the table. Miss A's story is not unique. Right now, 1 in 4 children in our state struggle to get nutritious food. And at PHS, we help thousands of individuals enroll in SNAP each year. But these federal cuts will push even more families to make impossible choices between food, rent, and medication. When the safety net is ripped apart, the burden falls on us, the nonprofit public health sector. We're ready to step up, but we can't do it alone. So here's our message to federal lawmakers. Fund what works, fund what saves lives, fund Medicaid and the community services New Yorkers count on. Don't dismantle the programs that keep families afloat. Instead, protect them, strengthen them. Because fighting for better health isn't politics, it's just common sense. Thank you. And I'm going to pass it over now to Sylvia Martinez.
Good morning, everyone. I would like to say thank you to our Congressman Ritchie Torres and Governor Hochul for this invite, and also Ms. Contreras for hosting us this morning. My name is Sylvia Martinez, and I am a long-term resident of the South Bronx, which is the highest asthma rate of New York City, but also of the United States. And Lincoln Hospital has been, I could say personally, my sister survived because of Lincoln Hospital of a bad asthma attack and was here housed for about a month and a half in the trauma unit. I am a member of Mothers on the Move for 23 years, and being on Medicaid has been an impactful source of medical resource for my family. My daughter was born with a cleft lip and palate, which is extensively expensive to have repairs done, alongside with my medical and dental issues. Being on Medicaid as a recipient has relieved many financial hardships, which I would face paying premiums out of pocket for my own necessities as my daughter. Medicaid is a vital program that brings peace and personal security, not just to myself, but many residents of New York State and other states within themselves, seniors, people in nursing homes, people that are bedbound, dialysis, and many other medical life security. Losing Medicaid would mean that I, just like many others throughout the United States, would suffer medical insecurity, but also show a lack of consistent, healthier medical care and need medications and would lack thereof. So they would have to decide whether they want to go to the doctor, get their medications, or even get care. Medicaid would be something life-saving, but also if you lack thereof, food insecurity will also not give you the balance of whether you're going to eat, pay for medications, pay for a doctor. It would be not sustainable in either way to get what you need. Because if you can't put food on the table, you can't eat properly, to take your medication, to do nothing thereof. Medicaid has been a sustainable source in my home, like many other homes in this community, not just for myself. My mother, who was on dialysis for a long time due to being a diabetic. My daughter's medical issues of 24 years, being born with a cleft patients too require a lot and extensive repairs. And I, as a recipient who lost her job due to health issues of my own, have that as a testimony. And I will fight with everyone involved to fight this fight until it's won.
That concludes our program. Thank you for attending. We look forward to seeing you again. Please get home safely. Safe travels.